Okay, so now we're going to head into, so we've done if you sort of go back to your program, we did the setting of the scene this morning, and then we've done a bit of the what's happening and what can happen. And now we're sort of going to move into looking to the future. So I'm going to have Siloma to come back up here, and we're going to be talking first of all about regional Pacific health planning and do a bit of a session on that. And then Steve's going to talk us through some around Pacific network and potentially, you know, how do we take things forward from today's start, or today's beginning really. And that should take us through to around about 10 to 3. And then we'll just have some closing comments, and the Reverend will close for us. And then at 3 o'clock we'll take those that want to do the tour of the cancer services down here. We'll take that tour through for the next 2 hours. So thanks, Siloma. What we're going to do is I'm going to just scribe, because Siloma's going to ask some questions, and I'm just going to put some key points up on here. Now my typing skills are not fantastic, so you might just have to bear with me a bit.
Thank you, Jo. And I promise this is the last time you'll see me up here. Jo asked if I brought a presentation for this part, but I thought after digesting all the information, the presentations that we've received, I think it'll be much nicer and a better activity to interact with you and see what your thoughts are in going forward. So what I'm going to ask you, following all the information, the presentations today for Pacific on cancer, have a think and see if we have to choose 3 or 4 things that we can focus on for Pacific regarding cancer, what would they be? Because I believe that in our own little regions, we can't do it alone. If we work together with specific focus on things that we know there are gaps in services for Pacific, and if you remember the things, the presentations was about the rates of cancer in what did anyone pick up? I'm sorry I wasn't here earlier on. Pick up on Dr. Allen's presentation this morning. Were there highest rates of cancer in Pacific in that presentation?
It was more Samisi's presentation around female and male
cancers.
Higher cancer rates. So it was talking about for female, it was breast, uterine, cervical, ovarian and stomach, and for men it was prostate, lung, thank you, liver and stomach.
All right. So taking those into account, looking at women, if the highest cancers in women is breast and cervical, knowing that we have low rates of screening in both, 61 and 64 or 65. So knowing those things that you know, and then prostate cancer in men, do we think that we need to prioritize 3 or 4 areas to focus on for Central Cancer Network to focus on going forward for Pacific, also knowing that what the Central Cancer Network will incorporate is the Regional Services Plan. And the Regional Services Plan is the region's plan for delivering services in the next five years. It's like, you know, the strategic plan that each DHB used to have that no longer exists, but there's a regional services plan. So for Pacific, going forward, do you think that's a good idea? We focus on 3 or 4 things to be our work streams to give to CCN, to give to the Regional Services Plan for Pacific, for services to focus on. Good idea? So, here's the hard one. Tell me which areas they are you want to... This is the easy part. Which areas do you think that Pacific people need? Which, is it a service delivery? Is it a funding thing? Let's talk about the funding, because, but you know, those are the things we need to look at. So there's any suggestions?
Pacific Island, it might be wise to look upon it on the, those areas affected by the hormones. So it was breast, cervical, the ovarian, and in terms of reproductive areas, and raising awareness amongst the Pacific community that this was really important, because it doesn't really matter how much you put into services if people out there are not aware why. Then there's a whole lot. And that would also go into encouraging the use of the HPV vaccine, because that's a preventative thing out further.
Mm. So when you're talking hormonal, are you looking at health promotion, health information, or screening?
I think you can do the whole lot. It's actually raising awareness for the health professionals and for the families and for everyone else, because that was an area that came through.
Thank you. Vai?
Thank you, Siloma. I think one of the areas that we as health professionals know that is lacking within our Pacific people is health literacy. And I think dissemination of information, health information, is very vital. And I support the comments from my sister here that we should raise their awareness by disseminating the information on cancer, how it affects us, and then work on from there. And I think, you know, when you said 4 points, I quickly jotted down the points that I was thinking of. And that's first of all is dissemination of information and raising the awareness, you know, in health and cancer especially. And then looking at the prevention education. And then thirdly, screening. And then fourth, the treatments.
Thank you, Vi. Do we know, Joe, because all I'm aware of is the screening services in the sub-region, Wairarapa, CCDHB and Heart, and we've got two beautiful young health promoters, Pacific health promoters, but they are not Pacific specific. Even though they're Pacific people, it's not a Pacific role. It's a general role that they're doing. So what's the Central Region's screening? Is there Pacific screening? Or
not as far as I'm aware, and I know there was a question earlier on today, and I'm sure we can talk to that, but there was also a question earlier today about contracts, particularly with Pacific providers as well. So, Anne, do you want to talk to that from a risk screening perspective? Or she'll be back, but she's just...
The National Screening Unit is actually targeting Māori and Pacific Island. What Anne Alamatoa brought up, and I think Pacific people need to be very aware and take great joy about it, but it's not good for Māori, is that Pacific Island screening for women and breast screening is higher than Māori levels of screening. and across the whole of New Zealand, and is nearly on the 70 mark when you look across the way. It's not to say that people need to relax. And so the targeting is on inequalities, let's put it in that way. For breast screening coast to coast, the lead provider across the way, our position of inequalities is held by my sister here, Talasia Brown, who has a Samoan background. So we're trying.
What I probably wanted to say, agreeing with what has been put up on the board, but it's the pathway of people then coming from the education to actually having a screening. So there has to be a Pacifica-driven pathway to all those screening tools and screening. So as we said when we were getting people to come for cervical screening, it was a knocking on door by door process. So unless there's clear pathways, no amount of education is going to get anybody anywhere really. Unless that's. And the second one I'd like to say is that Pacifica training in cessation. So cessation training for Pacifica, so that they can work in their communities.
Cessation.
Yes,
you mean smoking cessation?
Yes, smoking cessation. Sorry, smoking cessation training for Pacifica, so they can then work in.
I just wanted to add on. I'm from Palmerston North, this region here, together with Fololi. Now we are currently working for the Manawatu Primary Health Organisation, managed by Compass Health. We've been there 4 years now. Now, originally, Fololi was a cardiac nurse, and I'm a respiratory nurse, community. Now we have got this great long-term called clinical community nurse, long-term condition, with a focus in respiratory. That's me. Fololi's a focus in cardiac, as well as specific. Now, they've added on the Pacific. Now, we're so listening to, there are no Pacific Island health providers in this region. Now, they have added on this role to our jobs, which we think we're going to work kind of like 1.7, not full-time jobs. I think this is a good time that we could come in and, join in the cancer networking that's going on. Probably, we might not be able to do everything all at once, but it's a step forward.
Thank you. Te rangi. Yeah, you go.
Just to go back on what you say about the workforce specific to Pacific. My understanding coming into the job was it was a Pacific-specific role. It started off with a Pacific-specific, and then the DHB did away with it, with no consultation whatsoever. That is the experience I'm finding within the Hutt Valley DHB, and also with the breast and cervical screening. So for me and my fellow colleague here, that beautiful princess across the road there, Palolo, we are the A-all and the B-all. There is no specific role within the screening program. And that's sad, because they expect us to deal to the 3 DHBs within the Greater Wellington region, and so how are we going to bridge the gap if we are looking at the low participation rate of our Pacific women within the Greater Wellington region? So I want to take that back. We do not have a Pacific role specific to Pacific.
Thank you.
Just to answer to that. Got it.
Yeah.
I think your question was very specific. Whaia Tarangi.
I was, Velda Walters here, I was really impressed with the men's health group that I went to. And I think we've talked a lot, and I know that, breast screening and that is high on the list, but I felt that more support for promotion for men's health issues. I see that there's a lot of really interesting things going on in the community at the moment, and I think we need to promote that a lot more, because I think they're all doing a great job, but I think more about men's health would be really good as a focus. Yeah.
Thank you. They're important as well to carry on the population, aren't they?
Thank you, Siloma. To me, I believe what our Pacific people need is a proper promotion service. You know, we need to identify services out there that's doing a good job and give them some funding to do the work. Because sometimes when there's a lot of services like health professional services. Our people are not going to those services. We need to understand that. But there are services that they are not health professional, they are not GPs. But people seems to be taking a message from those services. So we need to identify that and support those services, and that's why we need funding as well.
Thank you. I'll just say one more thing before we identify the second area that we want to focus on. It's a shame Anne's not here, because every time I see Anne, I'm bugging her about Pacific funding from the ministry, that because I'm sick of hearing the low rates of Pacific screening cervical and breast, and yet nothing changes. So it's a shame she's not here, because I think unless policy reflects the resource allocation to the need, it'll never happen. DHBs have already identified their priorities, and we've got the national health targets, we've got the regional health targets, we've got all these frickin' targets that everyone needs to focus on. But unless policy reflects resources to where the need is, it'll never change. But my need is simple. As a Pacific person sitting at the strategic level, I know the strength of our workforce is our community health workers, our support workers, because I know our clinicians are very limited. We've got a very small number of nurses, a very small number of doctors, and I want them to focus on clinical and disease and illnesses. I want our support workers, our health workers, to develop these skills that they have to work with our community. Simple needs, it only takes about 30, 40K for a community health worker to work with the screening units. They're the ones that will organise and mobilise the community to go to the screening. Those girls will do the screening side. We do the mobilisation of the community. So it's not a hard thing to do. So Joe put that down as one of the Pacific things that we need. And I totally support Lau Pepe's concern that there has to be a recognised Pacific health promotion provider to properly deliver. I mean, PHOs are now doing that role as well. But wouldn't it be nice if there was a Pacific Health Promotion Service? So,
I take what you say, but I think I need to stand up for Anne here in terms of the screening services, because from a public health point of view, population screening programs usually take 20 years to be embedded. Now, I know that the cervical screening has been around for a while, and there is a whole lot of issues that need to be looked at about access and support in Pacific for that. But as far as the breast screening to go, to get to the level that it's at, especially with Pacific Island people, but right across the way, when Australia has only got to 56% and it's been going for another 10 years, is good. And so you should celebrate the good things. But what I was trying to say right back at the beginning is it's not just the health workers that should be giving the message. The message should be out there so it happens in the church, that it happens everywhere, and it came up in the men's health area too. It's the bigger things that don't belong to anyone, that are part of something like a Fono or a thing where everybody understands, and no matter what their job is, they check out and allow the whānau or the families to make informed choice whether or not they take part in the screening, and they don't just go because they're told and don't understand about it.
Thank you. I'm not putting Anne down, because I know it's hard for one Pacific person to argue in an environment that she's a lone voice. at ministry, at DHB, it's hard. But we also have competing priorities there, because the Pacific population is small compared to the needs of the bigger population. So it's a juggling act. Thank you. Tua?
I suppose my question goes to the Cancer Society or Cancer Network, because we're actually talking very much on the DHB, PHO level, but I was wondering what the Cancer Society, I think that was a question I raised well from the beginning in our first meeting, was are there any Pacific nurses working within the Cancer Society in a way to reach whatever we're trying to do with our people? That was my other question. And then it goes back to what the girls are doing. You know, I speak from the heart in Wellington. They've done a marvellous job. And for Te Rangi, and you know, they've done a marvellous job, even though it's not specifically Pacific. I'm sure they do Pacific on top of the list, and the others come last. So they're actually doing it themselves. They've taken it on board that the Pacific community, Pacific women need that. The thing about health promotion, and we need to look at, I think there's another issue, is looking at the journey start from the beginning. And often we look at the treatment side a lot of times, but we need to look at the education part, which is the health promotion. And many times we do big health promotions, but there's no one-to-one talk. We go to health promotion, we give out pamphlets, we give out this, but there is no one-to-one. And that's where the education, for example, we talk about health promoters or educators. You don't have to do a big training, 3 years, 6 years training, to actually do a specific job that they can do well in the community. We talk about the whānau, water, everything else. Of course, that's how we've always worked. You know, it's a concept that's been talked about. But you know yourself and I, in everywhere we do, when we go to see a patient for cardiac, we see everyone else. And that's what we've taken up as specific people, because we know everyone needs something. And I suppose my concern is we haven't got enough nurses, we haven't got, and I suppose with Anne being a one person in the ministry, and I also question, what is the Pacific, what's the other side in Ministry of Health? I mean, what are they doing there? And then you look at the population health where, what's the other Pacific advisor? Yeah, working. What are they doing within that area in a way to channel those things down for us? So
very good questions too.
And the PHO itself, we go because our counterparts with Folole here and Lupe here in Palmerston North. I work for Campus Health now. And we're doing a marvellous job. You know, our outreach nurses I even go in the Misikulena GP practice. I even set up clinics for cervical smears, and they're doing very well. So the more we do that, say Folole, you can start doing that for people with the bigger population of Pacific community. I'm sure you'll start their job. So I think with us who are already in the system, we need to do a bit extra on top of what we're doing, because it's a hard job. It's not easy for us to identify and pick up those people to go out to work. Thank you.
Thank you, Tua. As for the queries about Pacific nurses in the cancer, it's the Central Cancer Network, and it's only been around for how many years, Joe? 3 or 4? 4 years, and it's a body that's tasked to manage the cancer work of the region, the DHBs, and so it's not a provider such as providers, you know. It's
but I picked up on your comment, and what I'd put down was, because you did talk about the Cancer Society, and I wonder, were you reflecting the Pacific workforce in those cancer NGOs, for example, the Cancer Society, that there's not that? Okay.
So how much time have we got?
So we've got 400.
Oh, don't say it. Sorry. So we've identified the screening.
So, perhaps, shall I just, I'll just run back through them. So whilst there's a number of different points in here, once we actually group them together, we'll actually have a main focus really around health promotion in the general sense, specifically Pacific. And then there's some issues in here around screening, and we can pull those together. We've got that smoking cessation, which fits in under that health promotion. Health literacy, so again picking that up under those areas there. Men's health can be picked up under the health promotion. The identifying services who are doing a good job and funding them to do that work, so that's the more at that policy type level. We've got a few things at the policy level, that resource allocation and making sure that you've got Pacific actually working at that policy level, and then there's a few workforce items that we've got there as well. So I think, you know, we can reasonably group them into particular focus areas. And whilst we can try to influence the regional services plan, my guess is that we may not be terribly successful in getting things terribly visible within that plan just at this present time. But I think if we can start to build this up, especially within the CCN work plan and our wider DHB Pacific plans, etc., then I think we can make some movement.
I think we can group together the health promotion, health literacy, health education into one, and then screening will be into one.
And then policy and workforce.
Yeah, policy and workforce. Because I think it's really important. I think, Joe, that CCN can provide the advocacy in terms of the RSP, influencing the RSP from the central, but we'll also try from the DHB side, because I think screening is one of the areas that is identified as, it's not a top priority, but it's a priority anyway. We'll make it a priority. So that's health education, health literacy, health promotion, health prevention. Workforce is the other one. So workforce and screening. So we've got the three. Do we believe these are the three important areas that we need to focus on? The cancer pathway journey.
So within the coordination and that happens within the
navigator type role.
That's certainly something that has been raised in a number of different forums, especially in some of the hui that we've had around the region for support navigators, coordinators. And in recently the Ministry of Health have released this supportive care guidance and the implementation plan that sits alongside that. Now, one of the main components of that is around care coordination, and key activity going forward next year is you may have heard of the Faster Cancer Treatment, which is a program of work that's coming out of the ministry and will be led by the ministry, the DHBs and the networks, around looking at a whole cancer pathway, a 62-day cancer pathway, essentially from suspected a high suspicion of cancer through to first definitive treatment. And for that to actually happen, to enable that to happen, the care coordination has to work very effectively within that process. So over the next couple of years, there will be a lot of activity happening around care coordination, resources, and just process realignment around that.
Okay. Just a couple more things while Joe's typing. I'm just thinking, Joe, when's the next round of inequalities?
The Central Cancer Network's been able to do rounds of inequalities funding. We're just in the middle of our third round at the present time, the second round that the local cancer networks have had. And we've been able to do that because we've had underspend from previous years with our budget. But unfortunately, going through from this year, we've sort of passed that that space. So one of the things that we are trying to consider for next year is around the men's health and some focus around men's health. And as Steve talked about, potentially accessing some funding via the Cancer Society for that, to be able to take that through as a focus for 2012-13. However, we had an Inequalities Forum earlier this year, and it was very clear from that there was a strong message that even though there's a small amount of funding, in which it was 10,000 per district, it actually, the effect of it has been huge around the partnerships that have developed and the products that have been able to be produced with that. So it's certainly something that we'll be trying to source some funding so that we can actually keep this as a sustainable part of our program.
Yeah, thank you, Jo. I just thought you might want to know those things because sometimes you don't access reports from DHBs, and I'm sorry, part of that is my fault. I don't let you know often enough. But also the responsibilities of myself and Taima and the other Pacific managers that are able to disseminate the information to all of you so that you're up to par with what's happening in the. But so my final question, I suppose, is this forum, where to next? You know, from here, I think you've worked really hard. You've identified the areas that we need to focus on. And when the CCN work plan comes out, no doubt we'll send it out to you to have a look at and for comment. But also the RSP, if we feature anywhere in the RSP, fingers crossed. But from this forum today, is there anything that the workforce want to progress or to, do you think this was useful or do you think it was a waste of your time?
I'm actually just wondering whether we could actually invite Steve up now to do his, he's got a short presentation, but Steve's sort of starting to take some of this thinking forward as around, you know, what next. And so, Siloma, if you can stay up here, and then we'll have some more discussion after that.